ELI5 How does psychiatric therapy counseling work for depressed patients? Hello. As someone from Asia, counseling is really not much of a thing in my culture, and someone getting one could be looked down upon, kind of like reserved for the insane people. As I think I'm having some mental health issues, I would like to know how really effective it is. How does it work? To be honest, I really have doubts that just talking to someone you pay for is going to make any difference compared to just talking to a friend. Please tell me what the professional environment is like. Talking to a complete stranger can be easier sometimes than talking to your best friend. You know that your friend already has an image of you, and their view might become shattered if you tell them something you never said before. A therapist can help you open up and discover things you have hidden from yourself. Things that you might not have accepted about yourself, or things that you have interpreted the wrong way due to feedback from your family environment. I found cognitive behavioral therapy counseling very effective in treating depression. It helped me to understand others' behavior and my own reactions to it. It also helped me to be more aware of my thoughts, such as catastrophizing, and to let those kinds of thoughts drift by without becoming overly anxious about them. The professional environment is simply you and the therapist sitting in their office in some comfortable chairs, and you talk. At first you might not say much, but as you become more comfortable with the process, that will change. Therapists will give you a non-judgmental environment where it is safe to talk about what you are experiencing. But more importantly, they will help you to develop tools and behaviors to manage your mental health. For depression, it is not uncommon to have both a psychiatrist who specializes in medication management and a therapist who can help you to work through issues that make your mental health worse while helping you to find behaviors and tools that allow you to manage your mental health more effectively. Mental health counseling works because the person you are talking to is trained to deal with many things. Your friends do not have professional training to support you. Is talking to your friends bad? No, it's actually great if you can be that open with them, but sometimes the fact that a counselor is a neutral third party, they can give you better insight. Compare it to standing 2 inches away from a very large picture. What that image looks like versus standing 10 feet back to see it from a different perspective. Sometimes I want to hear a professional explain why the situation is the way it is, and then I can figure out what to do with my life. I feel like they are a great person to check in with, to remind you of doing the right thing whether you want to or not, and they won't judge you if you fail. They won't make you feel bad about it. They will help you find a reason inside to keep going. I like to gather information, and then based on the evidence I make a conclusion for myself. I also always am very vulnerable with them. I really do try because I want to get better. And it works. Mostly it's about changing the way you think. I will come to my therapist with a problem I'm having, and she'll help me understand that I'm assuming motive or projecting. I guess it helps most when your own thoughts are the problem. Patient here. With counseling, it's all about getting you to ask the right questions to help change your mindset. It won't cure depression, but will make it more manageable. For medication, psychiatrists prescribe meds that regulate your serotonin, helping keep your emotional state more even. That helps prevent depressive and, depending on the meds, anxiety episodes, which then allows you to think clearly about your situation and start fixing the things that have been triggering your emotional state. Unlike your friend, your therapist will not judge you or ever tell anyone or ever meet any of the people you talk about, and you can be absolutely sure they've heard worse. Also, unlike your friend, the therapist has an arsenal of possible solutions. And, unlike your friend, the therapist is paid to listen to you. So there's no guilt or expectation of other repayment, or need to consider whether they're up to listening to your problems right now. They showed up. They are ready to listen. It has the potential to change and save lives. You make an appointment with a psych. Tell them about your problems and/or diagnoses, and they talk about options for medications they can prescribe you. In my experience, there are two kinds. One prescribes drugs, and that's basically their whole job. The other helps you assess your thoughts and thought processes and helps you change your perspective on the world in a way which is more compatible with your life. Often, though not always, depression comes from having misplaced expectations or lacking in effective coping mechanisms. These are experts in identifying those deficiencies and addressing them. Are you multilingual? Can you do remote sessions from your home to keep it private? I think the premise of therapeutic talk therapy is that the patient lacks both insight or awareness into their emotional state, nor do they have the skills to handle their emotions constructively. Your friends may be able to give you some insight. They may be able to teach you how to deal with your emotions better. But they will not be able to do so consistently. Talk therapy is far more than a sympathetic ear. It's also a classroom. I've found that a good therapist can help alter the way you think. Sometimes this is changing the words you use or helping you look at things from a different perspective, of sometimes having a professional agreeing with you that what you're going through is hard and you'd be in denial if you weren't struggling is really empowering. Also teach you techniques to cope beyond staying in bed and feeling like crap. And even identify stressor or triggers to help you think your way out. I would suggest finding a therapist that understands the stigma surrounding mental health care in your culture. Addressing your feelings about therapy will help the therapy be more effective. Just think about it like your own life. Have you ever spoken to anyone and it's changed your way of viewing things? That might be knowledge, a concept, a way of behaving, even dancing, your diet, the ability to drive a car, etc. I can guarantee you have. Now think the subject is your mental health, something which you ruminate on. Only have your own perspective and way of doing things, reacting to the world. And now you meet someone new who teaches you new ways to approach your own mind. That's counseling. It can be totally life-changing. A therapist can't really take your depression away, but they can help you do some things. This may simplify things a bit, but if you picture depression as being lost at sea in a storm, a therapist is like a seasoned navigator, can't control the waves or bad weather, but knows what to do in a storm, which direction to go to, and may have some tips on how to face the dangerous waves. The waves are still there, but they aren't so scary with some help, and perhaps eventually you may be able to leave the storm, or survive long enough to see clearer skies. I went to therapy with 20 years of deep trauma, took meds at the same time. After 8 months of psychotherapy I was a new person. No depression, no anxiety, and I have learned to self-regulate well, so I can tell what's likely to cause me to spiral down in the near future, and either avoid it or face it with mental preparation that keeps me safe. When the therapy ended, I went off meds as well. Never needed to go back to them. Basically, there are pathways in your brain that are created by thoughts and your reactions to the thoughts. These pathways can create a depressive state of mind. If someone can guide you on how to think and react differently, you will make new pathways in your brain that are not depressive. A lot of times talking about problems with a trained professional helps. Part of it is simply talking about your problems. Another aspect of it is that the trained professional knows how to ask the right questions to encourage you and help you work through your problems constructively, or to see them in a new light that may give you understanding that you may not have had before.